You're watching KAMC News at 5.
The Biden administration has announced its plan to administer booster shots for the fully vaccinated. This comes before the FDA authorization. We want to bring in our medical expert, Dr. Samir Islam, to break this all down for us. I feel like there's so much new information all the time. We appreciate you taking the time. Thank you so much.
Absolutely, my pleasure.
All right, so do you think the FDA will provide authorization for this booster shot?
I think so. The data seems to suggest that as we get more and more further out from your initial shot, that the effect is starting to weigh down. And so I think that pretty soon the FDA and the CDC will go ahead and approve the booster shot for most people who go ahead and had the COVID vaccine before.
Okay, so you agree this is something that fully vaccinated people need?
Absolutely, yeah. Even though the vaccine itself is extremely powerful against COVID-19, what we're seeing is that effect just kind of goes down as time progresses. And so just like any shot, like a flu shot or a measles shot, there may be a booster you may need to hopefully improve that immunity within your system.
We ran a story on this a little earlier in the newscast, so it sounds like it's only for the people who receive the Pfizer and Moderna vaccine. If you receive the Johnson & Johnson vaccine, can we mix and match, or how is that going to work?
It's a really good question, and unfortunately, we just don't know the answer to that. So what I would suggest is if you got the Pfizer or the Moderna, typically 8 months after that is when the booster is going to be recommended. I anticipate with the Johnson & Johnson, we're going to get the same information later on down the road. We just don't have the information yet because that vaccine came so much later than the initial vaccines.
And I know we kind of don't really know too much about this booster shot. Is it going to be similar to those initial shots or just something kind of to like boost our immunity with it?
I think what we think is going to happen is that it'll be typically just one shot, at least initially, to help boost up the immune response within your body so it's more protected than what you may be having right now with COVID-19. Very similar to whenever someone got the initial vaccine in the beginning of this year.
Okay, and you mentioned about 8 months after you got that second shot to get this booster. So we're fully vaccinated right now. If you are we still protected from COVID-19?
100% yes. So what we're seeing is that if you got the COVID vaccine shot, you are extremely protected, not only against the virus, but more importantly from being hospitalized and even dying from the virus itself. So yes, if you get vaccinated, you are still extremely protected.
Okay, so still a good idea if you haven't gotten the vaccine. And I know the number of people getting the vaccines lately has been going up, which is good. But if you haven't gotten vaccinated, go ahead, start the process right now.
100%. There is no doubt in anyone's mind that you should get the vaccine now. This is the time for you to protect yourself, but also protect your family members who may be exposed to this really scary variant that's going around the United States right now.
And during our press conference with the health department earlier today, they were talking about these breakthrough infections. What is that? And do you know the percentage that we're seeing that right now?
So we are seeing some people who may have gotten the vaccine earlier lose that response over time and then maybe getting COVID again. Now, what we're seeing with those individuals is that the risk of COVID is still extremely low and the symptoms are very mild. But more importantly, if you got the vaccine and you happen to have a breakthrough virus, there's a very low chance of you being in the hospital and a very low chance of you being in the intensive care unit or dying from COVID.
So much good information. Thank you so much for being here with us today, Dr. Islam. We appreciate it.
Thank you guys so much. I appreciate that too.
We'll be back.